Well, joining us this morning is Dr. Beck with WesTex Urgent Care, and he's here to talk to us about Bio TE Hormone Therapy.
Yes.
So what exactly is that?
Bio TE is bioidentical hormone replacement therapy. A lot of people, when they get into their 30s and 40s, they may not realize it, but their hormone levels may drop. And the symptoms they experience may include fatigue, irritability, anxiety, depression, that type of thing.
Wow. And so this just helps kind of balance out those hormones.
Yes, absolutely. We call it optimizing the hormones, and the hormones that we're mainly referring to are testosterone, estrogen, and their thyroid hormones.
Okay, so what's the procedure to do this?
Well, the procedure is first we have to kind of know where people are to start with, so including a consultation with physical exam and a history. We'll do a blood panel which will give us the actual hormone levels. And if the criteria are met, then we'll talk to them about options for treatment. With Bio TE, we use actually small pellets that we put in their skin, just underneath the surface of the skin in the subcutaneous tissue. And then usually within a week to 2 weeks, the hormone levels will start to rise, and they peak in about 5 weeks. And then we confirm that the levels are optimized with blood test, a blood panel, after the pellets are put in.
Oh, wow. That's
so is this a pretty well-known treatment?
It's relatively new, but it's actually very popular right now. The company, Bio TE, started in the Dallas-Fort Worth area, and I started doing the pellets about 4 years ago.
What kind of results have you seen from it?
I've seen some really good results. People who were, as quote, couch potatoes that now feel active and are energetic and are want to get out and do things, and also for women that are menopausal, if they've gone through menopause or about to go through menopause or in menopause, it can be very beneficial and helpful treating their menopausal symptoms.
Oh, my.
And so what are some other cases where people could benefit besides menopause, especially in males as well?
Males may experience symptoms including fatigue, decreased stamina, low energy, lack of what we call mental fogginess, and that's where a lot of times, if we can get the testosterone levels boosted or optimized, a lot of those symptoms will go away completely, and it's hard to describe it, but people just feel better in general.
Okay. Now, I know you mentioned that the procedure takes about 5 weeks for you to see like the optimal results. How often do you have to go back and get the pellets put back in your arm, or do you have to go back again?
They're actually done in the upper buttock area. And they last, in men, the procedure lasts about 5 or 6 months, the pellets do. And women, it's about 3 or 4 months. So they come back every 3 or 4 months for females and every 5 or 6 months for males.
Nice.
And are you familiar with any side effects that may come with this treatment?
That's the cool thing about this. There's few, if any, side effects. I mean, when you're getting your hormone levels optimized, I'm not going to tell you that there are none, but they're very few and far between.
Okay. Now, it sounds like a treatment that would be great for just about anyone. So is it covered by most insurances, do you know?
The procedure itself is not covered by insurance. The prices are reasonably affordable, especially when compared to other treatment options. And the nice thing is, too, that we're starting a payment plan so that people can, in order to make it more affordable, or they can budget for it, we're going to have a monthly payment plan.
Oh, wow, that's awesome. Like you said, you can make it affordable for everyone then.
Yeah.
All right. Well, thank you so much for joining us this morning. Definitely some very valuable information I didn't even know about.
Me either.
Very cool. So we're going to send things back over to Chief Meteorologist Chase Menendez for another look at our forecast.